A state lawmaker wants to bring more awareness to the health of our brains. As Fox 13 News political reporter Ben Winslow shows us, State Senator Daniel Thatcher is speaking from firsthand experience.
Senator Daniel Thatcher is back on Capitol Hill, having suffered a series of strokes.
At 45, the idea of a stroke never entered my mind.
He says he feels 100% now, but wants others to know about the risks of stroke and how you can recover.
The faster you get care and the faster you get intervention, the more likely you are to have a positive outcome.
Folks under the age of 50 are experiencing more strokes, although those over 50 are dying less from them.
Liv Sasaki with the American Heart Association says when it comes to strokes, it's important to recognize the symptoms and react quickly.
If you are experiencing or someone you see is experiencing any symptoms, we like to use the acronym FAST. So F is face drooping, A, arm weakness, S, slurred speech, and if you recognize any of those signs, T, it's time to call 911.
The senator has been open about his medical condition, but concern for his health mounted during a high-profile debate in the legislative session where his colleagues worried he was having medical problems.
I was watching a heart monitor. I was concerned that my heart rate was going a little high, and so I took a few minutes to rest and to use breathing exercises to bring down the risk, and I think because people were so sensitive and because people were so hyper-focused on my health, I think there was a lot of overreaction.
Senator Thatcher is well known on Utah's Capitol Hill for his bills surrounding suicide prevention and mental health. And after going through what he has, the senator says he wants to start using new terminology, brain health, to discuss these types of issues and remove stigmas.
But the idea of brain health, the average person is not going to be able to know the difference between a mental illness, a mental health episode, substance use disorder. Someone who's having a stroke could display symptoms of any of those things. Someone who has had a traumatic brain injury could display any of those things. Someone with Alzheimer's or dementia. So using the term brain health is kind of a more encompassing, that doesn't require the ability to diagnose. And also it kind of takes some of the stigma away. Puts brain health on the same level as physical health.
Ben Winslow, Fox 13 News, Utah.